Hello, my name is Natalia Mann. I'm a major in public health. In this presentation, we'll be discussing cervical cancer. What is cervical cancer? It is first begin in the cervix. Then the cells become precancerous from various risk factors, usually human papillomavirus. Those who get HPV do not necessarily always get cervical cancer, though it can take several years for cervical cancer to develop. It can also take less than a year. On the other hand, in the United States doesn't have as many cases of cervical cancer than it once did. Dr. George Papanicolaou created the first effective screening for cervical cancer, though it's rarely discussed. The pap smear was created in the 1940s, and from then the program was made for cervical screening. Cervical cancer is the leading cause of cancer-related death in women, and it is the third most common cancer in a woman worldwide. After the age of 35, incidence and mortality increase over time, though in North Carolina the incidence rate has decreased since 1975. There is two graphs showing the steady line of white women who have cervical cancer. You can see it slightly increasing in women of color. It's now dropping. The second of the pie graph showing ages and the percentage of cases per age group. The most affected group is the 45 through 64 age group. The risk factors of cervical cancer include HPV, sexual activity, other STDs, giving birth at a young age, and smoking. The process of HPV-caused cervical cancer is usually a long one. If the HPV infection is grade of 2 or 3, it sometimes can cause precancerous lesions in the cervical lining. The women who get HPV infections often are also at risk for cervical cancer. Pap smears are done, and if abnormal cells are found, colposcopy and biopsy are done to see if patient has cervical cancer. Depending on what stage the patient is in, the MRIs may be done to see if cancer has spread to spine or throughout the body. There are 5 stages of cervical cancer, 0 through 4. Depending on what stage the patient is on, requires different procedures. Chemotherapy, radiation, and surgeries is usually recommended to treat it, though sometimes hysterectomies may be done if cancer is in later stage. Screening, pap smears, and vaccination are most important for prevention. Screening should be done between 21 and 65 years of age, and pap smears are recommended every 3 years. Sexual education is also necessary to ensure that children and adults know how to prevent STDs. Vaccination for HPV is also important in children to prevent it, though not all countries have access to this. There are many non-profit organizations that help women with things like screening, sexual education, vaccination, and support. Some of these include in North Carolina Cancer Center, the Center of Support Cancer, and the Foundation for Women Cancer. Healthy People 2020 plan to reduce the amount of cases of cervical cancer, though the number is already relatively low in the United States. They plan to do this by continuous sexual education and safety. Women who are in need of screening and children who need vaccination will also receive them through the Healthy People 2020. There are all my sources. Thank you for listening.